You just had a filling done, and this quick video will walk you through exactly what to expect and how to take care of your tooth over the next few days. First, numbness. Your lip, cheek, and tongue may still feel numb for 1 to 3 hours after your appointment, depending on the type of anesthetic used. During this time, avoid chewing, drinking hot beverages, or biting your lip or cheek, since you won't be able to feel if you're causing damage. Wait until the numbness has fully worn off before eating anything. Once feeling returns, you can eat normally, but if you had a large filling or one on a back tooth, it's wise to chew on the opposite side for the rest of the day just to let things settle. Some sensitivity is completely normal after a filling. You may notice your tooth reacts to cold, hot, sweet, or pressure for a few days to a couple of weeks, especially if the filling was deep or close to the nerve. This usually fades on its own and can be managed with a regular pain reliever like ibuprofen or paracetamol if needed. Your bite may also feel slightly different or high right after the anesthetic wears off. This is often just your brain adjusting to the new shape of the tooth. But if it still feels uneven or you're biting down harder on that tooth than the others after a day or two, contact your dentist because the filling may need a small adjustment. Keep brushing and flossing as normal, including around the treated tooth. This doesn't damage the filling and actually helps it last longer. If you received a white composite filling, avoid heavily staining foods and drinks like red wine, coffee, tea, or curry for about 24 to 48 hours, since the material can pick up stains while it's still settling. There are a few warning signs to watch for. If you have pain that is severe, throbbing, or getting worse rather than better after a few days, if you notice swelling in your face or gums, if the sensitivity hasn't improved after 2 to 3 weeks, or if a piece of the filling feels like it's chipped or fallen out, contact your dentist promptly. These aren't things to wait out on their own. For most people, though, any discomfort is mild and settles quickly, and you'll be back to eating and drinking normally without a second thought. If anything feels off, or you're unsure whether what you're experiencing is normal, always reach out to your own dentist. They know your mouth and your treatment best.